Well, there was hope for Sydney today with just 8 new COVID-19 cases recorded, 7 of those being linked to the Northern Beaches outbreak. It's good news for those in that community who are hoping for a normal Christmas and New Year period, but New South Wales Chief Health Officer Kerry Chant warned residents not to get complacent.
I really appreciate the efforts of people that are adhering to the isolation guidelines, and the feedback I've had is people are doing the right thing. So it is important. We need to remind people that there is a reason we isolate you for 14 days, and that's because the virus, even though you've had a negative test today, you can be positive tomorrow.
And to discuss the latest from Sydney and its Northern Beaches area is the Northern Beaches Council Mayor Michael Regan. Michael, are you optimistic about the situation in light of those most recent numbers and the level of contact tracing that's going on?
Yeah, good evening, mate. Looking forward to, is it a Christmas Day yet? We're working hard, obviously, over here to do our bit and do the heavy lifting, and today's number was very, very good. We're taking the advice, obviously, and being optimistic. And optimistically, we're cautious, but we're optimistic and we're excited. The number was really good today, but as you point out, it's those ones that aren't on the beaches, which is the concern for health at the moment.
The one thing that I've heard stated frequently by people with expertise in this area is that New South Wales Health is much more decentralised than its Victorian counterpart, which is one of the strengths of the system. Are you in contact with the Department of Health as a local government representative? Do you get regular briefings and updates that keep you in the loop, or do you have to just rely on the media reporting?
A bit of both. So we definitely talk to health, but more on the ground, and we're trying to support them logistically on the ground because we've got so many testing stations here, and they need a lot of logistics, be it the marquees, be it the lights, be it the toilets, be it just feeding them. So we've got some great groups that helping with that, including our staff. But I do talk to Minister Brad Hazzard, who's also one of our local MPs here, so I do talk to him. But they're pretty guarded in what they say, and for good reason, and they want to keep it to themselves. And I talk to the local CEO of Health as well, so she's been fantastic and giving me some updates. But broadly speaking, we're not giving anything ahead of the media, and probably for a good reason.
Michael, I guess you'd have a waiver then to be able to move around to help with your duties. So are you getting out and about a little bit and getting a sense of the community mood and how people are travelling, especially on the mental health ground? Like, is this I think a lot of us drew a breath in and thought, those poor people, you know, getting slammed with Christmas just over the horizon. Are you getting a sense that this straw broke the camel's back, or is there a bit of optimism rising in your travels?
There's always been a positive spirit, full stop. Like when this happened, it was just like, you know what, we've been here before, we've done it, we've, you know, schooled our kids at home and got through those, we've looked after our elderly relatives and the like. And so today, for example, my wife and I went down and did the grocery shopping for her parents and dropped that in. Everyone's wearing masks, and that was, you know, during the height of the pandemic, no one was doing that, like pretty much. It was rare or it wasn't as much, but everyone was doing it. So, look, the optimism is still there in the community. Everyone's still getting tested. We had 44,000 or something like that. I heard a number today, maybe over 100,000 have been on the Northern Beaches. Like, that's extraordinary. Like, so we're all doing it, but there's a sense of optimism, cautious, but you've really got to feel, and you just touched on it then, there's a mental health aspect of it. And so, because there's already about, 1,000 odd people across the state who are going to miss Christmas Day because they're in isolation. That's terrible. And we really feel for them, and we've got to look out for them. But locally, our staff jumped on the phones today, and there's something like that, 10,000, give or take, people that they've been in contact with starting today, just to check in, how they're going, what can we do to help, are you missing anything, can we do anything? So that's already begun from a council perspective, and I know there's a lot of volunteer groups out, the Viral Kindness Movement, the Feeding the Medics group, so we're all combining together to make sure that we've got each other's back and that we're not missing anything, and, you know, trying to get those gaps. But everyone's, you know, doing their bit, which is the most important thing. That's what we love where we live.
Michael, there was a lot of sneering on Twitter about Northern Beaches, almost a sort of a gloating that the outbreak occurred there. And bring the rest of Australia into this conversation. You'd have your share of community housing and social housing in your area, wouldn't you? There's not everyone. There's an idea that it's a Silvertail area, but you'd have as broadly a distributed wealth demographic as any other area in Australia, I would assume.
100%. And I mean, just in my street where I am here in Dee Why, I've got a nice little house on a little block of land, but just down the, 2-3 houses down, there's a great big block of public housing. Just down the end, Dee Why Public School, there's 55 nations that go to that school, and it's a fabulous school, and it's one of the best in the state. We've got some of the best public schools,
Yeah.
but it's just, there's a socio-economic thing. We've got, I think in the suburb of Narrowena, not just Narrowena, sorry, just across from LGA, that goes from Manly to Palm Beach to Belrose to Cottage Point, Duffy's Forest. We've got something like about 2,000 public housing, type thing, and there's a lot of social housing. So, yeah, we're a mix, and it's disappointing. But you know what, that's the nature of social media. A lot of
Pull together.
People look to, and it is what it is. And we're a great community, and we support other communities in their time of need. And I've been really touched by the people who've reached out to us saying, what can we do and how can we help?
That's
That's been really positive. So, yeah, look, I'm positive. Like, you think back 12 months ago where we were, we had our schools were being filled with smoke from all the bushfires around the state. Our crews were out there, our RFS crews were out there all through the state, doing their bit to help, and they missed Christmas. And but they came back, and then we were out there, and we've had the floods, we've had our SES crews were out there, and our RFS crews were back out there helping. So, yeah, we're pretty solid here, and we look after each other, but we also look after other communities. And whatever's said on social media, who cares? Like, we just want to do our bit, make sure we get Christmas Day, stay positive, and because we have a great community spirit here. We know we're lucky to live here. We work hard to live and work and play here. So, you know what, we'll do what we can to get through this, and we are doing it, and you're seeing that, and it's been with great response.
Good luck with it, Michael. Let's hope the numbers are even better in the 24 hours just gone. And Merry Christmas to you. Stay safe, and especially to those people in public housing and elsewhere who aren't as tech savvy or often have landlines only. Let's hope that those community outreach programs can reach them and make sure they get the spirit of Christmas and that great community you're leading. So well done on your efforts, and good luck. Merry Christmas. Thanks.
And Merry Christmas, and thank you for recognising that. It's much appreciated.